Yeast infections are uncomfortable and itchy, and many people don't like talking about them. They are quite common among women. Around 75% of the women will have a yeast infection once in their life. A smaller percentage may get recurring or multiple cases. Yeast infections can occur at any time and to anyone. There are some things that may make one more prone to getting them. Such infections can be cleared easily and quickly. How it happens. In the vagina, there is a lot of yeast and bacteria that has to be kept at very healthy levels. Due to the presence of estrogen, lactobacilli bacteria can grow. This is a bacterium that may end up killing organisms that are meant to help the vagina and keep it in a healthy balance. If this balance is ripped, Candida, the fungus, grows way out of control, leading to the development of yeast infection. What are the causes of such infections? There are very many reasons why someone can get this kind of infection. They include hormones. When you are pregnant, hormonal changes can cause the problem. Menopause, breastfeeding and the use of birth control pills can also change your vaginal balance. Diabetes, this is another cause of the yeast infections. If diabetes is not controlled as it should, then the mucous membranes get more sugar, and this creates a great environment for yeast to thrive. Antibiotics, these drugs tend to kill lots of bacteria that live within the vaginal and therefore may throw you off balance and lead to the development of the infection. Vaginal sprays and douching, using these kinds of products, especially when they are scented, is not recommended. The vagina maintains its own balance and rarely needs such things. The products can cause a change in the balance, leading to infections that could have been avoided. Weak immune system, for people who are HIV positive or people with any other kind of immune disorder, suffering from yeast infection can be very common. This is why it is important to get further testing, especially when the yeast infection keeps on recurring or doesn't respond to medication. Sex, in most cases, yeast infection is not listed as an STI. However, it is important to note that it can be transmitted to other people when you make sexual contact. It is therefore important to be open about your condition and receive treatment as soon as possible. Symptoms. The main symptoms of the infection are discomfort and itching. There are, however, some more signs that you can get in case you have it. They include redness, swelling, or burning of the vulva and vagina. The vulva is the outer part of the genitals of a woman. A discharge that is white and thick, very similar to cottage cheese. Painful sexual intercourse. Burning or pain as you pee. If you suspect that you could have an infection, it is always recommended that you see a doctor as soon as possible. Refrain from treating yourself. It is important to note that the above symptoms are not limited to yeast infections. There are many others that can present themselves in this way, and only a test can give the real picture. When you get a proper diagnosis, you will get better treatment. There are many ways you can pursue so as to get rid of an irritating yeast infection. Yeast infection treatment is a natural way in which you can handle the condition and have it clear within a very short time period.